To set something up in your clinic that's user-friendly, to measure their heel height, I initially start with them just on the floor. I mark their heel at 1 centimeter on the back so that I have the same place to mark on each side. I then have them go up into a calf raise with 2 feet before lifting up and holding with 1 foot. So I have them hold at the top. I can use my goniometer to measure the total heel rise height, and I give them about 5 seconds there to see how much drop they get. Then I'm going to move to the other side. We'll do surgical side second, have them lift up and hold, counting 5, 4, 3, 2, 1, and then capturing that height at the base of where they've dropped. This is a modified, simple way to do calf endurance testing in the clinic. We're going to use a metronome set to 30 beats per minute. As the patient is doing their calf raises to tempo, we're going to stop the test when they have loss of heel height, loss of frequency, or the patient stops because they're getting tired or it's too difficult. This is a good place to watch for compensation. You can see this athlete here, they have long toe flexion, which is a compensation strategy to help them get up, and they're curling. They may be flexing their knee for lack of plantar flexion, and maybe just lack of control. In this 2022 article, they were looking at heel rise performance and height, and they found that increased knee flexion appears to be a compensatory strategy for decreased ankle plantar flexion. So whether it's because they're lacking strength or contractile capacity, or maybe capsular stiffness, they're bending their knee to get their heel higher. So watch for this with your patients as well, and cue them for nice, clean movement. Early in rehab, we can use weight with our seated calf raises. In a lot of articles, 30 pounds is utilized right away with patients. Oftentimes I'll put a book underneath their heel, that way I can see what they're doing with their toes, but we're not dropping to plantar grade. We can utilize BFR in this for atrophy, and we're going to cue them again for lifting to their full height of range of motion. Patients often say their hip is getting tired here because they're trying to lift the weight with their hip, so make sure you're cueing them to push through the ball of their foot. If you have a knee extension machine, you could use that for adding more weight. It does get easier as we're trying to get closer to their 50% of body weight to use a knee extension machine and just lift it and put it up on top of their knee.